Welcome to the MS-Perspektive podcast, Perspektive with a K as I'm German. I'm Nele von Horsten, MS patient, patient advocate and author. I'm bringing you interviews, inspiration and information about living with multiple sclerosis and show you ways how you can positively influence the disease and make the best out of your diagnosis. On ms-perspektive.com you will find the show notes, 11 free tips as a PDF and lots of other information. And now the show begins. Thanks for tuning in again and welcome to episode number 77, Tailoring MS Treatment, the impact of mood disorders on patient care with Dr. Emine Rabia Koç. Dr. Emine Rabia Koç is Associate Professor at the Uludağ University Faculty of Medicine at the Department of Neurology in Turkey. And now the interview begins. Hello, Rabia. It's such a pleasure to have you on the show.
Hello, Nal. How are you? Thank you for the invitation.
Yeah, you are very welcome. Thank you for joining me for that interview. Before we actually start with the interview, it would be very lovely if you could introduce yourself to the audience so they know who is with me on the podcast today.
Okay. I am Emine Rabia Koç, Associated Professor at Uludağ University, Faculty of Medicine, Neurology Department. Working in the field of neurology is a passion for me. During my neurology residency, neuroimmunology and autoimmune diseases of the nervous system were particularly interesting me. After completing my residency, I started working and doing research in this field. The more I learned, the more I loved it, and I continued my education at training in this field. Since 2022, I have been a student in the MS Master Program organized in partnership with the University of Dresden and the European Charcot-MS Foundation, like you. I am also an ambassador for the Sumera Foundation to be a voice of NMOSD and MOGAD patients worldwide. I try to balance my life in this cycle. I am married and have 2 children, teenage children. The moments I spend with them are precious to me. I like walking, nature, swimming, cycling, and visiting different cultures and places in my free time.
Fantastic. Fantastic. Thank you, Rabia, for that introduction. And yes, we are actually studying the same, but you are studying in English and I'm studying the same one in German with some German neurologists, but we also had a couple of lessons together when there was the English guru, let's say. And we had these joint sessions which were interesting. But of course, when you decide to study it in German, you want to have most of your lectures in German. Anyhow, what was your personal motivation for choosing this career?
Maybe it may sound very cliche, but I have wanted to be a doctor since childhood. As you know, MS mainly affects young adults. So, from the moment the disease is diagnosed, you become a part of your patient's family. You start to share their joy and sorrows with them. You witness their special moments like marriage, birth, and children's growth. With each new patient, you open the cover a new book and start a new story with them. In fact, you write that story together. The complex, fascinating approach of neurology offers a unique opportunity to contribute to well-being of patients with MS. while working in this field, I aim to contribute to scientific research on the one hand and improve the quality of life my patients and to sign happy ending stories with them.
Yes, that is very good. And yeah, Chalf Ziemsen is my neurologist since end of 2008. So yes, he saw me 2 times pregnant. He knows, of course, my 2 little kids. He knows my mom because my mom sometimes takes care when they are babies, like the little one is right now. He doesn't actually know my husband in real life because he is not joining when I'm going to the appointments, but that's totally fine because I'm normally going in it just by myself. But of course, if it's better for you out there, please take somebody with you who helps you to get over these situations if you think they are better together. Let's start to talk about the impact of COVID-19, of the pandemic, and the support for future challenges, because you did quite some research in this. How did the COVID-19 lockdown affect mood disorders in MS patients, particularly regarding anxiety, depression, and isolation?
Oh, yes, the COVID-19 lockdown significantly impacted all of us, also the MS patients, the mental health of individuals living with MS. There are lots of studies conducted in this period, and we have a study too in this area, and most of them highlighted that many MS patients experienced increased stress, anxiety, and depression during this COVID-19 lockdown. Specifically, younger patients, those with progressive MS, and individuals with pre-existing mental health issues were particularly affected in this period. Okay, what was important? The coping strategies played a crucial role in determining the mental health outcomes for these patients. Those who employed active coping methods such as problem solving tended to maintain a more positive outlook, while those lacking effective coping skills reported feeling more negatively impacted. And the other issue is isolation. Isolation was a major challenge, leading to feelings of loneliness and that exacerbated anxiety and depression in this lockdown period. The absence of in-person support from the friends and family further contributed to the mental health struggles. Although some patients initially manage this period well, but there are concerns that prolonged isolation could lead to worsening mental health issues over time. So we can say that the COVID-19 lockdown heightened stress and mental health challenges for many MS patients, and certain demographics beings more vulnerable. And ongoing support and monitoring are essential to help the MS community cope with the long-term effects of the pandemic.
Yes. Yeah, I think we will still see some things happening, even so it's now over for a while. But I just had the discussion today with my infection. Do you want to know if it's COVID-19 now, so many years after the pandemic or not? I'm like, no, because at the end, I just had a fever, as you know. We had to delay our interview, but I had no issues with my MS. But the presence of the COVID-19 stresses too many people too much still said long after the pandemic. So yeah, I had an infection, I had fever, it's over, fantastic. And I don't make much more thoughts in that direction because it won't help anyhow.
Right, you're right.
So if a situation like the lockdown were to occur again, which could happen, what kind of support systems should be in place to help MS patients manage their mood disorders?
I hope not, but in the event of a similar situation occurring again, we should establish alternative support systems such as telehealth services and online support groups. Additionally, improving access to psychological support services and organizing community events to strengthen social connections will be essential.
Yes.
We learn lots of things about these periods.
Yeah, absolutely. And I joined two different of these online support groups at certain moments to talk about something about the podcast. But it was really nice. It was really nice to get together with these people. Even though I was not that much isolated, I still stayed in contact with other people. But I totally agree. It's really important to keep up with some social connections, even so you might not be able to see in person.
Yeah, we take on the guide.
Yeah. What have we learned from the lockdown that can be applied to improve mental health support for MS patients in the future?
I think one of the most important things we have learned is that the pandemic has highlighted the importance of mental health alongside physical health. The effectiveness of remote therapy and support groups was proven, indicating that future mental health services should be more accessible and flexible.
Yeah.
I think the most important thing is that.
Yes, absolutely. I totally agree. Okay, so we want to understand the mood disorders in MS a little bit further. How common are mood disorders like depression, anxiety, and bipolar disorders among MS patients?
Generally, mood disorders are highly prevalent among MS patients, with significant implication for their overall health and quality of life. We know that. Approximately 30% to 50% of individuals with MS will experience a major depressive episode at some point during their illnesses. The high rate is attributed to both the challenge of living with a chronic disease like MS and the biological effects of MS itself. Anxiety, also most prevalent among MS patients, and also some experts suggesting that anxiety may be as common as depression.
Okay.
The unpredictability of MS symptoms also contributes to heightened anxiety levels, which can severely impact patients' daily lives. And bipolar disorders in the MS population is also higher than in the general population. And all these mood disorders complicate the management of MS. So, and all these disorders are associated with lower quality of life. So if the presence of these disorders can complicate the management of MS and lead to worse health outcomes.
Yeah, and worse health outcomes is something we don't want. So, can you explain the connection between MS and mood disorders and why MS patients might be more susceptible to these conditions? Are there any answers or ideas?
Yes, there are many ideas about this. Mood disorders we know highly prevalent among individuals with MS. Why? Because due to the combination of biological, psychological, and social factors. If we look what are these factors, we know MS causes demyelination and lesion in the brain. And these lesions can affect areas for responsible mood regulation. These neurological changes can lead to emotional disturbance such as increased sadness, anxiety, or even euphoria in some cases. Euphoria very rare, but we can see euphoria too. Another factor, inflammation, inflammation in the brain associated with MS may also contribute to mood disorders. The inflammation can affect the brain neurotransmitter system and that are crucial for regulating our moods. The psychological impact of living with MS can exacerbate mood disorders too. And only receiving an MS diagnosis can lead to feeling of grief, fear, and uncertainty about the future, which can contribute to depression and anxiety in this group patients. Regular screening and integrated treatment approach can help us for effectively manage this challenge in MS patient, I think.
Yes. And of course, I mean, I received my diagnosis begin of 20s when I just started to study. And yes, for a few weeks, luckily just a few weeks, but I thought like, oh, I have a really dark future and there's not much lovely in that future for me. And why me? And yes, of course, all these negative thoughts.
Yes.
But luckily, I got over it very fast because I have good friends and lovely family, and that helped a lot. So I think the supporting system is always important.
Yes, it is so important.
Yeah. So how does understanding a patient's mood disorder influence the overall treatment plan for their MS?
Understanding the mood disorders in MS patient is crucial for developing effective treatment plans for us and the patients. If we look to mood disorders influence MS treatment, the first, I think the most important point is holistic treatment planning. When we recognize a mood disorders like depression or anxiety in MS patients, we can create treatment plans with address both neurological and psychological needs. This means that treatment will not only focus on the physical symptoms of our patients, but also aim to improve mental health, which is vital for overall well-being.
Absolutely.
The other important point, I think, treatment adherence, because patients with mood disorders often struggle to stick to their treatment plans. For example, depression can lead to feelings of hopelessness and fatigue, and making it hard to follow prescribed medicines by identifying and addressing mood disorders early. Doctors can implement strategies to improve medicine adherence, such as counseling or medication for depression or anxiety. This can enhance the effectiveness of main MS treatments. The other is important point, tailored interventions. If a patient is depressed, their treatment plan may include antidepressants and therapy or lifestyle change to boost the mood. If anxiety is present, therapies like cognitive behavioral therapy is so important, can help manage symptoms. And in personalized interventions, importance in this point. And patients with mood disorders may need more frequently check-ins and support. And if we address the mood disorders in MS patients, we can greatly enhance a patient's quality of life too. So, what we can say, understanding a patient mood disorder is essential for creating effective MS treatment plans for us.
Yeah. Absolutely, because you always need to see the full picture, not just the MS by itself, but of course there's very often more to it, and it's important to treat really, to have the 360-degree picture of the patient.
Yes, absolutely.
So let's move on to some best practices and recommendations. What are some of these best practices for managing mood disorders in MS patients that you found effective in your clinical experience?
I think the most important thing is the multidisciplinary approach. You mentioned before, collaboration among neurologists, psychologists, physiotherapists, and other health professionals to support overall health. The second important is tailored treatment plans to individual needs. Use antidepressants or anxiolytics effectively. Provide emotional support and some coping strategies such as cognitive behavioral therapy. And engaging in support groups can reduce feelings of isolation. And doing regular exercise can improve both physical and mental health by releasing endorphins. And meditation may be deep breathing exercise and relaxation strategies to manage stress. All of are so important for effectiveness.
Yes. Yeah. And I just read an article in the National Geographic magazine. I'm reading this magazine since more than 20 years now. And there was an article about how to get along with some stress that is coming with your normal life. And they really, they pointed out many different things, but meditation was really a big thing where you can really improve a lot. And there's lots of research done already. And it's clear that meditation can help to balance stress out, anxiety, mood disorders, various things. So I thought I don't have issues there, but I think even getting older might be sometimes stressful, or having 2 little kids. Meditation would be something I could somewhere sneak in my tight schedule. It would help a lot, I guess.
Right.
So what advice would you give to MS patients who are struggling with mood disorders and their caregivers?
This is a teamwork. I can say firstly, managing life with MS can be challenging, and it's crucial to have strategies to support both the patients and those who care for them. My advice for my MS patients: please don't isolate yourself. Living with MS can feel lonely at times. Connecting with support groups and people who have similar experiences can help elevate these feelings and make you feel more supported. So please don't isolate yourself. I
Yes.
repeat again. Share your feelings. Talking to a trusted friends, family members, or therapist who. But please talk and set small goals, achievable goals. This can boost your sense of accomplishment and motivations. And take care of yourselves. Doing regular exercise, a balanced diet, and adequate rest are crucial for your overall health. And be kind to yourself, please.
Yes.
Practice self-compassion and respect the challenge you face and encourage yourself throughout difficult times.
Yeah.
And caregivers, it's so important. Don't neglect yourself, because this is teamwork, and you are the most important support service and seek support. Take time for yourself. Engage in activities and hobbies you enjoy to recharge and maintain your own well-being, and communicate openly. Be patient and understanding, because recognizing the patient's feelings and needs strengthens your supports. Both patients and caregivers can navigate this journey more effectively by supporting each other and staying strong together. We can advise both patients and caregivers.
Yes, yes. And these are very, very good advice. And I think it's really important that caregivers are taking care on themselves. So I think the advice for the patients, probably most patients have heard about them, hopefully, but the caregivers are really important as well. Who among the MS patient population might benefit most from being tested for mood disorders, including bipolar disorder? Because I guess it's not common sense that it is done everywhere.
Yes, you are right. In our clinic, we have neuropsychologist and who screens every newly diagnosed patients for mood disorders from the very beginning stage. And we repeat this screening test every 6 months. And if there is any deterioration in this test, we consult our patients with our psychiatrist and direct their treatment with a multidisciplinary approach. And if we detect any deterioration, we should consult our patient with our colleagues and psychiatrists.
Very good. That's something I would hope for most patients. Be it the case, but I guess it's not normal. But it's really great starting from the beginning and then repeating it every 6 months, because then there's really not much of a delay if something happens with the mood or mindset.
Yes, even we didn't see anything else in MRI imaging. We can detect the pathology deterioration in this test. These screening tests are very useful to detect the early pathology.
Great. Is there a short questionnaire or screening tools that can help identify MS patients who may be experiencing mood disorders, such as bipolar disorders, and should seek further evaluation?
Oh yes, but remember, these scales are only used for screening, not diagnosis. But yes, there are lots of scales present to screen these mood disorders, but only screening. I
Okay.
highlighted it.
Yes. So let's say if somebody is worried about it, he or she could do such a screening test. And if there is you might have mood disorders, you might have anxiety issues, you might have depression issues, he or she should talk to the specialist and do a check again and not do self-diagnosis.
Yes.
Please, dear listener. Yes. No, I think, but that's really an important point you made here. Okay, so let's move on to the quickfire Q&A session. Complete the sentence. For me, multiple sclerosis is?
A puzzle with many pieces still missing.
Yeah, unfortunately. Hopefully, there will be more pieces be found in the next years. What development would you like to see in the field of multiple sclerosis in the next 5 years?
I would like to see advancement in personalized medicine for MS, and I would like to see identification of reliable biomarkers for predict disease progression and treatment response. And I hope that we will yield new therapies promoting especially remyelination and neuroprotection. And I hope for improved accessibility to MS treatment and research all over the world.
Yeah, for great wishes. Let's hope they come true in the next 5 years. Would be very lovely, and at least if some of them can be solved, the biome. I mean, each one would be great. Let's see. So, okay, we are coming more and more to the end of our interview, Rabia. So, finally, what message of hope or encouragement would you like to share with individuals living with MS?
Be hopeful and patient. To everyone living with MS, I want to emphasize that you are not alone in this journey. And there is a vibrant community of support out there, and advancement in research and treatment are happening every day. Embrace your strength, seek out connections, and remember that every small step forward counts. And your experience matters, and together we can continue to push for a brighter future.
Yeah.
And I can say again, be hopeful and patient.
Yes. And of course, I could do a podcast every day. It's just I don't have enough time for it. But yes, there are each day some little steps in research in treating MS better. So I can totally agree on that. But I can't do 14 podcasts in a week, 7 in German and 7 in English. So I have to stay with one. And miss out on some of the advancements, but I guess hopefully I'm talking about enough of them. So how and where can interested people follow your research activities, Rabia?
if the patients and you are interested in following my research activities, you can find updates on my work through my university website and social media platforms like LinkedIn and Instagram with my name, and I put them here. And where I engage with the MS community, I encourage everyone to stay connected, as collaboration and communication are key to advancing our understanding of MS. Thank you.
Yes, absolutely. And I'm always, or not always, now I'm getting used to it, but I'm really surprised how many of you from the International MS Master's Program are active on Instagram. It's not the same for our German group, but I really like that. I think it's great because it's great for the patients, and it's great to see that you are active, you are doing sports, you are giving examples for little steps people can do, and being hopeful, being positive, staying positive, and why it's really worth it staying positive and staying active. And that's so great. So Rabia, thank you very much for all your research on that topic, for treating patients every day, for sharing your experience and your research findings. It was very, very lovely. And I hope to see you at one of the next ACTRIMS in person, probably not in Copenhagen. My little one is too small, but maybe next year in Barcelona or somewhere else. And yeah, thanks a lot. Bye-bye.
Thank you very much. Thank you for your invitation again. Thank you for your support and efforts. See you.
See ya. Bye. I hope you enjoyed the interview and learned something new. And by the way, next time it will be another episode about one of the immunotherapies. This time it will be all about cladribine, which is known under the trade names of Mavenclad, Loistat, or Litac. And please tune in again and recommend the podcast to whoever might be interested in it. Please rate it wherever you're listening to the podcast, and stay as healthy as possible and positive as possible. And hear you next time. Bye. Thank you for listening today. I hope you found it helpful. You may also be interested in the previously published episodes and posts, which you can find at ms-perspektive.com/podcast. Perspective with a K. You can also get a free PDF with 11 tips for your positive impact on MS at ms-perspektive.com/newsletter. If you'd like to get in touch, you can reach me at nele@ms-perspektive.com or on social media. See you next time.